CEN Written Exams Review 2022. Question 1. A patient with organophosphate poisoning presents with excessive salivation, bronchuria, and muscle fasciculations. The CEN should anticipate: Option A, atropine and pralidoxime, 2-PAM. Option B, naloxone. Option C, flumazenol. Option D, activated charcoal. The correct answer is option A. Atropine and pralidoxime, 2-PAM. Organophosphate poisoning, e.g., from pesticides, causes cholinergic crisis, sludge, salivation, lacrimation, urination, diaphoresis, GI distress, emesis. Treatment includes atropine, to block muscarinic effects, and pralidoxime, 2-PAM, to regenerate acetylcholinesterase. Decontamination is also essential: remove clothing, wash skin. Naloxone is for opioid overdose, flumazenol for benzodiazepines. Question 2. A patient with hyperkalemia has a potassium level of 6.8 milliequivalent/L and peak T waves on ECG. Which intervention should the CEN anticipate? Option A, sodium bicarbonate. Option B, calcium gluconate. Option C, insulin with dextrose. Option D, all of the above. The correct answer is option D, all of the above. Hyperkalemia management includes membrane stabilization, calcium gluconate, to protect the heart, shifting potassium into cells, insulin with dextrose, sodium bicarbonate, beta agonists, and removing potassium, K-oxalate, dialysis. Calcium gluconate is given first if there are ECG changes, peak T waves, widening QRS. Insulin with dextrose and sodium bicarbonate shift potassium into cells. K-oxalate or dialysis removes potassium. ECG changes indicate a life-threatening emergency. Question 3. A patient with cardiogenic shock has a cardiac index 2.2 L/min/m superscript 2 and elevated filling pressures. Which finding would the CEN expect? Option A, warm, dry skin. Option B, cool, clammy skin. Option C, bounding pulses. Option D, widened pulse pressure. The correct answer is option B, cool, clammy skin. Cardiogenic shock is characterized by decreased cardiac output and increased systemic vascular resistance, SVR, resulting in cool, clammy skin, oliguria, and hypotension. This is in contrast to distributive shock, septic or neurogenic, where skin is warm and dry due to vasodilation. Management includes inotropic support, dobutamine, and vasopressors, norepinephrine. Question 4. A patient presents with a foreign body sensation in the eye, tearing, and photophobia. The CEN should: Option A, use a slit lamp to examine the eye. Option B, perform fluorescein staining and a slit lamp exam. Option C, irrigate the eye. Option D, all of the above. The correct answer is option D, all of the above. A corneal foreign body or abrasion requires a thorough examination under a slit lamp with fluorescein staining to identify the location and extent of the injury. Irrigation may be needed to remove loose foreign bodies. The CEN should identify and remove the foreign body if visible or refer to ophthalmology for removal. Antibiotics are often prescribed. Question 5. What is the chain of custody in the context of forensic evidence? Option A, the sequence of people who handle a sample, ensuring it is not tampered with. Option B, the chain of command in the ED. Option C, the medication administration record. Option D, the patient's medical records. The correct answer is option A, the sequence of people who handle a sample, ensuring it is not tampered with. The chain of custody is the documentation of every person who has handled a piece of evidence, e.g., blood, urine, clothing, from the time it is collected until it is presented in court. Maintaining the chain of custody ensures the evidence is not tampered with, lost, or contaminated. This is crucial in forensic cases, sexual assault, violence, etc. Question 6. A patient presents with acute chest pain, shortness of breath, and a pericardial friction rub. Which ECG finding is most characteristic? Option A, ST segment elevation in all leads. Option B, PR segment depression and diffuse ST elevation. Option C, Q waves in leads 2, 3, AVF. Option D, tall, peak T waves. The correct answer is option B. PR segment depression and diffuse ST elevation. Pericarditis is inflammation of the pericardium, presenting with acute chest pain, pleuritic, better leaning forward, a pericardial friction rub, and diffuse ST segment elevation, often concave upward, with PR segment depression. It is distinguished from STEMI by the lack of reciprocal ST changes and the diffuse nature of ST elevation. Treatment includes NSAIDs, colchicine, and steroids if refractory. Question 7. A patient presents with acute onset of severe dyspnea, pleuritic chest pain, and tachycardia. The patient has a history of DVT. The CEN should suspect. Option A, pulmonary embolism. Option B, COPD exacerbation. Option C, spontaneous pneumothorax. Option D, asthma exacerbation. The correct answer is option A. Pulmonary embolism. This presentation with risk factors, DVT history, is classic for pulmonary embolism. PE should be suspected in patients with acute dyspnea, chest pain, hypoxemia, and signs of DVT. Diagnosis is confirmed with CTA. Treatment includes anticoagulation, heparin or direct oral anticoagulants, and possibly thrombolysis for massive PE. Question 8. A patient presents with suicidal ideation and a specific plan to overdose on pills. The CEN should. Option A, ask the patient to sign a no-harm contract. Option B, place the patient on a 1:1 observation and initiate a psychiatric hold. Option C, discharge the patient home with a safety plan. Option D, administer a benzodiazepine to calm the patient. The correct answer is option B. Place the patient on a 1:1 observation and initiate a psychiatric hold. Patients with suicidal ideation with a specific plan require 1:1 observation, suicide precautions, and a legal psychiatric hold, 5150, Baker Act, etc. A no-harm contract is not sufficient and may provide a false sense of safety. Discharge is contraindicated. Benzodiazepines may be used for agitation but are not the primary intervention. The CEN should remove all potential self-harm items, sharp objects, belts, etc., and ensure constant observation. Question 9. A patient with adrenal crisis, Addisonian crisis, presents with hypotension, hyponatremia, hyperkalemia, and nausea. The CEN should anticipate. Option A, 4-hydrocortisone. Option B, 4-normal saline. Option C, 4-dextrose. Option D. All of the above. The correct answer is option D. All of the above. Adrenal crisis is a medical emergency requiring 4-hydrocortisone, 4-normal saline, 4-hypotension, and 4-dextrose if hypoglycemic. Signs include hypotension refractory to fluids, nausea, vomiting, hyponatremia, hyperkalemia, and hypoglycemia. Prompt treatment prevents circulatory collapse. Hydrocortisone should be given before the patient is transferred to the ICU. Question 10. Which sign is most suggestive of a factitious disorder, Munchausen syndrome? Option A, inconsistencies in the patient's history and symptoms. Option B, a history of multiple hospitalizations. Option C, unexplained physical findings. Option D, all of the above. The correct answer is option D, all of the above. Factitious disorder is characterized by the patient feigning or inducing symptoms for secondary gain, attention, care. It presents with inconsistencies in history, multiple hospitalizations, and unexplained physical findings. Unlike malingering, there is no external gain. Careful history, documentation, and consultation with psychiatry are recommended. Question 11. A patient presents with sudden onset of severe, sharp, lower abdominal pain radiating to the flank, nausea, and hematuria. Which diagnosis is most likely? Option A, appendicitis. Option B, renal calculi. Option C, ovarian torsion. Option D, diverticulitis. The correct answer is option B. Renal calculi. Renal calculi, kidney stones, present with sudden, severe flank pain, renal colic, radiating to the groin, nausea, vomiting, and hematuria. CT scan without contrast is the diagnostic test of choice. Pain control, 4 opioids or NSAIDs, and fluids are the mainstays of treatment. Ovarian torsion presents with adnexal pain and should be considered in female patients. Question 12. A patient has a smoke inhalation injury. Which finding should raise concern for carbon monoxide poisoning? Option A, cherry red skin color. Option B, headache, confusion, nausea. Option C, SpO2 95% with significant distress. Option D. All of the above. The correct answer is option D. All of the above. Carbon monoxide, CO, poisoning causes headache, confusion, nausea, and, later, cherry red skin color. Pulse oximetry, SpO2, may be falsely normal because it cannot distinguish between oxyhemoglobin and carboxyhemoglobin. Treatment includes 100% oxygen, non-rebreather mask, and possibly hyperbaric oxygen therapy for severe cases. CO levels should be measured by CO oximetry. Question 13. A patient with Guillain-Barré syndrome is admitted with rapidly progressing weakness. The CEN should monitor for Option A, hyperthermia. Option B, respiratory failure. Option C, hypertension. Option D, tachycardia. The correct answer is option B. Respiratory failure. Guillain-Barré syndrome is an acute demyelinating polyneuropathy that causes ascending weakness. The most serious complication is respiratory failure due to respiratory muscle weakness, diaphragm and intercostals. CENs should monitor vital capacity, negative inspiratory force, NIF, and tidal volume. Intubation may be necessary if vital capacity drops, 15 ml/kg, or NIF decreases, -20 cm H2O. Question 14. A patient presents with a sudden onset of flashes of light, floaters, and a curtain over their vision. Which diagnosis is most likely? Option A, retinal detachment. Option B, central retinal artery occlusion. Option C, acute angle closure glaucoma. Option D, vitreous hemorrhage. The correct answer is option A. Retinal detachment. Retinal detachment presents with flashes of light, photopsia, floaters, and a curtain or shadow over the visual field. It is an ophthalmic emergency requiring immediate ophthalmologic referral. Treatment includes surgical repair, pneumatic retinopexy, scleral buckle, or vitrectomy, to reattach the retina. Question 15. A patient presents with an animal bite, likely a dog bite. The wound is deep and contaminated. The CEN should Option A, irrigate the wound and close it primarily. Option B, irrigate, debride, and administer rabies prophylaxis. Option C, administer antibiotics only. Option D, apply a pressure dressing. The correct answer is option B. Irrigate, debride, and administer rabies prophylaxis. Animal bites, particularly from wild animals, require thorough irrigation, debridement, and rabies prophylaxis, post-exposure prophylaxis, PEP. Primary closure is generally not recommended to prevent infection. Antibiotics are indicated for high-risk wounds, e.g., deep, contaminated, or on the face. Tetanus prophylaxis is also indicated. Question 16. A patient is in respiratory distress with a heart rate of 120, respiratory rate of 36, and SpO2 of 85% on 4L/min nasal cannula. The patient is anxious and unable to speak in full sentences. What is the appropriate next step? Option A. Increase oxygen to 15 L/min via non-rebreather mask. Option B. Intubate immediately. Option C. Apply BiPAP. Option D. Administer bronchodilators. The correct answer is option A. Increase oxygen to 15 L/min via non-rebreather mask. This patient is in respiratory distress with hypoxia, SpO2 90%. The first step is to maximize oxygen delivery with a high-flow non-rebreather mask, 15 L/min. If the patient does not improve, non-invasive ventilation, BiPAP, or intubation may be needed. Bronchodilators are appropriate for bronchospasm but not the primary intervention in all cases. Intubation is considered if the patient fails non-invasive measures. Question 17. A patient's ECG shows a heart rate of 40 bpm with wide QRS complexes and no association between P waves and QRS complexes. This rhythm is Option A. Sinus bradycardia. Option B. Atrial fibrillation. Option C. Third-degree AV block. Option D. Ventricular escape rhythm. The correct answer is option C. Third-degree AV block. Third-degree, complete, AV block is characterized by complete dissociation between atrial and ventricular activity. The atrial rate is usually faster, P waves, than the ventricular rate, wide QRS escape rhythm. This is unstable and may require transcutaneous pacing or atropine, though atropine is less effective for infranodal blocks. Question 18. A patient with DKA, diabetic ketoacidosis, has a blood glucose of 500 mg/dl, pH 7.2, and bicarbonate 14 milliequivalent/L. The CEN should anticipate Option A. 4 insulin bolus. Option B. 4 normal saline and insulin drip. Option C. Bicarbonate infusion. Option D. Potassium replacement. The correct answer is option B. 4 normal saline and insulin drip. DKA management includes 4 normal saline fluid resuscitation, continuous 4 insulin infusion, and monitoring of electrolytes, especially potassium. Bicarbonate is not routinely recommended unless pH 7.0. Potassium depletion is common and should be monitored and replaced before insulin treatment, as insulin drives potassium into cells. Insulin is given as a continuous drip, not a bolus. Question 19. A patient with an asthma exacerbation has a peak expiratory flow rate, PEFR, of 40% of predicted. Breath sounds are quiet, and the patient is using accessory muscles. The CEN should recognize this as Option A. Mild exacerbation. Option B. Moderate exacerbation. Option C. Severe exacerbation. Option D. Life-threatening asthma with impending respiratory failure. The correct answer is option C. Severe exacerbation. A PEFR of 40 to 50% of predicted indicates a severe asthma exacerbation. Signs include dyspnea at rest, use of accessory muscles, and quiet breath sounds. Treatment includes continuous nebulized beta agonists, ipratropium, systemic steroids, and consider magnesium sulfate. A PEFR 33%, confusion, or a silent chest indicates life-threatening asthma, which may require intubation. Question 20. A patient with a corneal abrasion should receive which treatment? Option A. Antibiotic eye drops. Option B. NSAID eye drops. Option C. Cycloplegic agents. Option D. All of the above. The correct answer is option D. All of the above. Corneal abrasion, scratch on the cornea, is treated with topical antibiotics, to prevent infection, NSAIDs, for pain, and cycloplegic agents, to reduce ciliary spasm and pain. A patch may be used for comfort but is not always recommended. A slit lamp examination with fluorescein staining confirms the diagnosis and rules out a foreign body or ulceration. Question 21. A patient with a suspected overdose of opioids has a respiratory rate of 6 breaths/min. The CEN should: Option A, administer naloxone 0.4 mg 4. Option B, administer naloxone 2 mg 4. Option C, administer naloxone 0.4 mg IM. Option D, administer a naloxone drip. The correct answer is option A. Administer naloxone 0.4 mg 4. Naloxone is the opioid antagonist used to reverse respiratory depression in opioid overdose. The standard initial dose is 0.4 mg 4. If there is no response, the dose may be repeated. Naloxone can be given IM or intranasally if 4-access is not available. The CEN should start at 0.4 mg 4 to avoid precipitating severe withdrawal in opioid-dependent patients. Question 22. A patient presents with a near-drowning event. The CEN should be aware of which complication? Option A, aspiration pneumonia. Option B, pulmonary edema. Option C, hypoxia. Option D, all of the above. The correct answer is option D, all of the above. Near drowning can lead to aspiration pneumonia, pulmonary edema, and severe hypoxia, which may progress to ARDS. The priority is airway management, oxygen, and treating any underlying causes, e.g., cervical spine injury. The patient should be monitored for respiratory distress, electrolyte abnormalities, and neurologic injury. All of these complications are possible and require monitoring. Question 23. What is the most common presenting symptom of acute coronary syndrome, ACS, in women? Option A, crushing substernal chest pain. Option B, atypical symptoms such as shortness of breath, nausea, and fatigue. Option C, radiating pain to the left arm. Option D, syncope. The correct answer is option B. Atypical symptoms such as shortness of breath, nausea, and fatigue. Women, elderly, and diabetic patients often present with atypical symptoms of ACS, including shortness of breath, nausea, vomiting, fatigue, and epigastric discomfort, rather than classic crushing chest pain. This can lead to delayed recognition and treatment. Emergency nurses must maintain a high index of suspicion for atypical presentations. Question 24. Which triage system is used in mass casualty incidents? Option A, START, simple triage and rapid treatment. Option B, SALT, sort, assess, life-saving interventions, treatment/transport. Option C, Manchester triage system. Option D, both A and B. The correct answer is option D, both A and B. START, simple triage and rapid treatment, and SALT, sort, assess, life-saving interventions, treatment/transport, are the triage systems used in mass casualty incidents. START categorizes patients into 4 categories: red, immediate, yellow, delayed, green, minor, black, deceased/expectant, based on respirations, pulse, and mental status. SALT is a more comprehensive version. Question 25. A patient with acute cholecystitis presents with right upper quadrant pain, nausea, vomiting, and fever. Murphy's sign is positive. Which diagnostic test is preferred? Option A, abdominal ultrasound. Option B, CT scan. Option C, HITA scan. Option D, X-ray. The correct answer is option A, abdominal ultrasound. Ultrasound is the diagnostic test of choice for acute cholecystitis, showing gallstones, gallbladder wall thickening, and pericholecystic fluid. Murphy's sign, pain on deep inspiration while palpating the right upper quadrant, is a classic finding. Treatment involves NPO status, 4 fluids, antibiotics, broad spectrum, and cholecystectomy. CT may be used if complications are suspected.